Dear students, we will discuss an entity which is not uncommon, which is basically a cosmetic entity, a benign entity that is called as potato nose, not potato tumor, so potato nose. So before discussing that, we'll have MCQs as such. So the keratoacanthoma is A, B, C, D. Put the right answer in the comment box. I appreciate your answer and acknowledge your answer. Now, before going to the second MCQ, I request students please subscribe my YouTube channel, share with your friends and colleagues, press the bell so that you will have the regular day-to-day basis brief understanding of the surgery subject on the images, instruments, clinical cases, operative procedures, specimens and so on. And also we'll have a live session once in 2 to 3 weeks where 1.5 hour interactive session where students will present a common case which will be discussed in the exam, where other than me, senior faculty will be there in the online. So interaction will be very good and you will learn how to present a case. It will be very, very useful for your practical exam and how questions will be asked by the examiners. So what answers will be there also. So it will be very, very useful for you. So please join this live session whenever it is there. If you join live session, you will get a certificate which will be very useful for your future surgical career. Again, request please subscribe my YouTube channel. And next MCQ is extra memory paget disease of skin is A, B, C, D. Put the right answer. I appreciate your answer. And we'll go to the condition of what this condition is. See the nose here. There are multiple small studded things are there. See that what are the possibilities you have to think of, and what's most likely of this in this patient. So this is this one. See that you can see that the small nodules here. See that in the nose, tip of the nose. The cosmetic doesn't look good, but it's a benign condition usually. Remember. So typical rhinophyma, potato nose or bottle nose, which are the different names. So potato, very popular name is potato nose. Actually, technical name is rhinophyma. Often it is called as bottle nose. All these different names. Potato nose, potato tumor is different. Remember, this is the potato nose. So it is what is it? It is due to hypertrophy and adenomatous changes in the sebaceous glands. It is glandular form of acne rosacea causing immense thickening of the distal part of skin nose with the visible open sebaceous follicles. It's very important. Sebaceous cells are, sebaceous ducts or follicles are opening there. So they get thickened for some reason and causes this what is called as a rhinophyma or potato nose. So treatment is cosmetic surgery, dermabrasion, resurfacing, laser. It is staged procedure many times, remember. So one sitting it may not be able to do that. Usually it can be done under local anesthesia, but 2, 3, 4 settings are required to control this one. Another important thing you have to remember is differential diagnosis. It may be basal cell carcinoma, it may be squamous cell carcinoma also. Sometimes there will be association. That is also important. So you may have to do a biopsy to rule out those conditions, or whatever you have scraped, you send it for histology, because you can't miss major diseases like malignant skin conditions. So this is the point which is very important in this very entity, cosmetically important entity, potato nose or rhinophyma. So for details about these things, please you can refer my manual of surgery or clinical methods in surgery. Photos are there, treatment strategy is there, the differential diagnosis are there. So MCQs will ask, and sometimes they'll give a short note, 2-mark short note also. Rhinophyma, you should be able to tell what is it. Mainly it related to the sebaceous glands. That is the point which you have to remember. And also, how it looks is a typical look, and what are the differential diagnosis of treatment is a cosmetic surgery, remember. Quotation of the day is the most important thing in communication is hearing what is not said. So what is said is don't require, what is not said you are here and understand that one. That is the most important. Again, very useful for a surgeon. So students, again I request you to have my manual of surgery which covers entire CBMS syllabus, useful for UG and PG. The best book currently available which covers general surgery, gastro surgery, endocrine surgery, thyroid, breast disease, vascular disease, arterial disease, neoplasm, then specialties, then instruments, operative procedure, anesthesia, adjuvant therapy, with the quotations, footnote in each pages, and investigation management, lot of photos and illustrations, concepts, tables, diagrams, everything is there. And each chapter there is online MCQs are there. which is very, very useful for NEET exam or any competitive exam, even general exam, general surgical exam. So it is entirely very useful book for any students, UG or PG, to understand surgery in a best way, and also have my clinical method in surgery, which how to examine a patient, all types, hernia, thyroid, breast lump, general examination, peripheral disease, venous disease, swelling, ulcer, mass abdomen, rectal examination, specialty examination, briefly orthopedic, with the instruments and specimens. And also it gives a detailed method of a lot of photos of examination. Each chapter has got a QR code which shows the examination method, video. So that will maybe hernia, for example, hernia, video examination will be there. Hydrocele video examination will be there. Thyroid examination will be, video examination will be there. Like that, very, very useful. And also, it gives a differentiated diagnosis in a tabular form. That is also very useful to remember and recapitulate and reproduce in a exam. But it does not contain investigation treatment. It's basically a clinical book, very, very useful. Please have it, and so that learn how to examine a patient in a beautiful way. So students, again I request you to subscribe my YouTube channel and share with your friends and colleagues, and daily upgrade your surgical knowledge by brief lectures, and once in a while join the live session for proper interactive 1.5 hour session, so that you learn surgery in a best way. So students, I hope you have understood this lecture very well. Thank you so much.